I will elaborate later. So MRS means medical record system basically. What is the health technologies? Basically, technologies uses in healthcare is becoming more and more basically important as it becomes an indispensable component of any national healthcare system. So technology uses in healthcare is very actually necessary as a demand for current healthcare system. High quality information availability is the prerequisite for high quality healthcare basically. If you want to give the quality care, all the information related to patient should be available basically. Because without the information, without the medical history, past history, how can you basically give a treatment? Normally we basically depend on, sometimes we depend on the memory basically. Doctors recall, okay, I have seen this patient 6 months before. Can you memorize everything 6 months before? You have thousands of patients, hundreds of patients per day even. It is not possible to memorize everything about the patients. So system will help us basically. It will save, and next time whenever we require, we will just give a single click. Socio-technical design basically, this is a new term. So many years back basically, when people used to develop a system for the healthcare system, they only consider, okay, we need computer, we need software, right? We need software and we need server, we need laptop, we need desktop, we need tab, we need mobile device. But only the software and the hardware is not enough to establish a system for the healthcare. You see, there is a picture. There is a software system, there is a hardware system, but there is a gap. You see, the gap is basically cognitive and social system. So for example, if you develop a system in Bangladesh and you want to basically use in the USA, it will not work. Why? You can say the same system. Why it will not work? If it is work in National Heart Foundation, it should be work in an American National Heart Foundation also. But it will not work. Why? Because there are some social aspect. People's psychology and the culture are different. For example, European people love black and white type color. Right? In African country? No. They love very colorful. The red. You will see the, the Chris Gale. He always wear the red shoe, always the yellow shirt, because they love color.
Zigzag dress.
Zigzag. Brazilian also the same. Latin America also very. Jamaica, they always love colorful. And in Bangladesh we are middle basically. We don't like that much color, and again not black and white. We are middle basically. So our color taste is very much, I think, is appreciable. So you have to consider that also, because in the software, if you use, for example, in a software button, if you use like a black button, the African people will not love maybe, because they love colorful things. European people, they love simple design, very simple. They don't like the strong color. So if you give a system which is very red or green, strong color, they'll say, no, I will not use this system. It's too much, bad for my eyes, because that will distract the physicians. This is basically psychological impact, the cognitive things, because we always basically make decision based on our cognitive process and our culture. Also the religion also important. It can be something, if you use some symbol, some people may say, no, why this symbol is coming, right? Maybe some software company use some symbol which is resemble to a religious symbol. It can be many things, okay? So you have to consider the context basically. And based on the context, you have to modify the system and then you have to deploy. So you should always mind, Even in Bangladesh, you have to also consider the different cultural or area wise difference. Because in Sylhet, Borishal, Noakhali, it can be differ from, right? There is some difference because Noakhali people are more religious. Sylhet people are more religious. But in Dhaka, we are not that much. So there is some impact, from area to area. So you have to consider always. And you have to also consider the social aspect like the income, per month income, their literacy, everything you have to consider whenever you develop a system for them. If someone is illiterate, how can you expect that he will use a latest system, the high technology he will use? First, you have to basically give them train. Without training, they will not be able to use the systems. So you have to consider that what is the target customers, the users, and based on their basically aspect or social status, you have to design your system. So that is basically is called socio-technical system design. So whenever you will design the system, you will always consider the social, cultural, religious aspect. And you have to customize the system based on that. And every area or country you have to customize. And then what is e-health basically? E-health is the basically umbrella term. I already told you that e-health is the basically umbrella term, and under the umbrella there are a lot of system, you can say, like telemedicine system, EMR, mHealth, everything is under e-health. Or we can say digital health, same thing. Normally, we call it e-health, health information professional basically we are used to with e-health. But now WHO basically introduced a new terminology. Instead of e-health, they are saying digital health. Okay? So the definition, basically according to WHO, this definition, e-health is the use of information and communication technologies, ICT, for health. So anything you used, basically, information and communication technology, if you use in healthcare, that is e-health. So everything falls into it. mHealth, telemedicine, AHR, EMR, whatever you system are talking about, which is used in the healthcare, that is e-health. And so this is the diagram: healthcare management information system, telemedicine, telecare system, mobile health, also we call it mHealth, short, Internet of Things, IoT, which is a different type of, we have device, and the device basically is now Wi-Fi enabled. So you can collect data through the internet, and you can manipulate, you can analyze, and you can make decision. That is the IoT, Internet of Things. And then clinical decision support system, CDSS. So doctors can use a system that will help them to make decision making process. So any doctor basically is treating a patient, so he's a little bit confused. So he can input all the data, patient data, to the system, CDSS, and CDSS can give a decision like, okay, this patient has a cancer or not, due to the analyzing the data. So it's possible, the clinical decision support system. E-prescription or and e-appointment. So doctor can basically write the prescription from the system, not the manual. So if you write manual prescription, it is difficult sometimes to understand the drug name. They write it in a very hurry, so it is not, and government basically recommended that you have to write the prescription in a capital letter. Do you know that? This is already law, basically. You have to write in a capital letter prescription. Electronic health record or medical record. So all are basically fall into the under the umbrella. So electronic medical record, I will not that much go through basically, just definition. The electronic medical record basically, an electronic medical record is a single practice digital version of patient chart. So it's a single facility that is available your health record. So an EMR contains the patient's medical history, diagnosis and treatments by a particular physician, nurse practitioner, a specialist, dentist, surgeon, clinic. So there are many roles here basically. So anyone in healthcare is working and treating a patient, they can use the EMR. And the same thing, an electronic health record is also a digital version of a patient chart, but it is a more inclusive snapshot of the patient's medical history. Electronic health records are designed to be shared with other providers. That is the difference. So EMR is basically used in a single facility, one hospital, and the EHR, electronic health record, basically is called share health record. So it is basically the data is shared by many providers, many hospitals, many clinics. So you are individual patients, your health record is available in different facilities, healthcare facilities, that is EHR, or you can say shared health. So whenever we talk EMR, means this data is one place, and EHR means your data is available to other providers also. That is the main difference basically. OpenMRS, you ask the OpenMRS, what is the OpenMRS? OpenMRS basically is a collaborative open source project to develop software to support the delivery of healthcare in developing countries. This is basically EMR, but WHO basically is there basically considered that there are many countries they don't have that much resource to develop a big system, and they don't have budget also. So what they did, basically they developed a open source system, free software, and they basically keep in the online. So if you need, you can download today, and you can install in your server, in your hospital, and you can start using. This is the software, already develop a template already. Have you heard the WordPress? There is a content management system. If you want to develop a website, you can just download a WordPress software, CMS system. You can log in as an admin, and you can develop a website within 2-3 days. So you don't need to develop anything. It's already there. You will just drag and drop, customize, and you can. The same concept here. This is basically a framework. So you can download. This is free software. You can just, you see the find patient record, active visit, appointment scheduling, register a patient, capture vitals, reports, data management, configure, metadata, system administration. You can configure here. System administration means you can configure, you can use, you can create a user. For example, you have a nurse, you have a medical doctor, you have a specialist. You can create here user, and they can log in and they can use the prescription module. Or whenever the new patient will come, register a patient. In the receptionist, he will use or she will use that module. So the module is already developed. You will just download, you will install, and you will readily use. So you don't need money, that much. You can just hire 1 or 2 people, technical people, and they can make it for you. Otherwise, if you don't use this, if you want to develop a new system according to your need, then it will take 3-4 years. You need 20 or 25 people, software developer, you need architect, you need tester, you need a big team. 3-4 years, you need 10 crore taka. So it's a huge expensive. EHR and EMR is not a, basically is a very expensive system. It's not cheap. So I will describe basically, illustrate some application which is used in Bangladesh basically. E-health system, but you already heard the name, right? MyAPA, very popular in Bangladesh. Basically, what is MyAPA is doing basically? You can get a health consultation basically, especially women. Those women are feeling like, okay, they feel shy, okay, they have some sensitive information they don't want to disclose. Basically, they can connect with this through this app, and they can ask different type of questions, health related, women, and there is a consultant there available. He or she give the, different type of advice. And so this is used, basically MyAPA is a personal digital well-being assistant. It is an anonymous messaging platform. Anonymous means your identity will not be revealed. So nobody will understand or identify you. Who are you? And at the same time, you are getting the medical assistance. So it's a very interesting tool, right? So this is a messaging platform basically only, the messaging only. You can send message like chatting, you can send message, you will get reply. That connects user with expert advice available on web and mobile, both available, you can connect. You can try today. If you, from your home browser, you will just, MyAppa, you're right. Or in the Google App Store, you can just search MyAppa, you will get this app. So you can download, you can test. In a simpler terms, it digitally connects subject matter expert to user queries with its intelligent platform. The service is reinventing the way people in developing countries access a specialist advice. Bragg initiated this project basically. So basically, the service is reinventing the way people, basically the developing countries, people are very feel shy to visit doctors and discuss about her, the different type of problems. He feels shy, right? The male people also feel shy if it is like different type of sensitive disease, right? So that can be solved, right? Because your identity will not be revealed. Nobody will understand, the advisor or the consultant, he will not understand or she will not understand who are you. So you remained basically unidentified. So there is another app, basically Aponjon. You heard about this app, right? Aponjon. Basically, child and maternity health, basically people can use this app. Maternal and child health is a big concern in Bangladesh. It is a big initiative to serve expecting mother, basically. It is a MAMA initiative, Mobile Alliance for Maternal Action. It is one of the successful projects in Bangladesh, basically. Basically, pregnancy period, you need different type of advice. Care plan, diet plan, right? So through this app, you can get support. So it's also very interesting. So as a health informatician, you can come up with some ideas, right? You also can design some app like MyAppa, Aponjon. You can, for example, dengue. How to prevent dengue? You can develop an app to aware the people. So they will be, stop basically different type of threat they can avoid. We know why the dengue is basically is affected people. We can take some measure, right? So we can use mosquito net, we can use long sleeves, long pants, So there are some preventive measure you can basically develop an app and people can use that app and they can aware and they can protect the disease. So this is a Aponjon. This is a very, very popular app basically. And there is a Baby Tika. Immunization program for your children. You can configure through this app. This is free app basically. This is available in App Store basically. If you go App Store, you can download basically. It's a free. So your children, if newborn children basically, you can configure. So which day the immunization program is, you can just configure and it will give alert, advance alert, 1 day before or 2 days before that, okay, you have this. Most of the time we forget it basically. We are so much busy, sometimes we forget that our children or our children has a immunization program, we forget. And then after 2 days, oh, I forget. And you know how much problematic if you forget the right time and date. It will be a big problem. Shastho Batan, have you heard this? You can call now basically. If you face any problem, medical related problem, just now you can call 16263 and someone will pick the phone basically. And you can discuss your medical problem, health related problem, and he or she will give you some advice and you can just follow that. So this is very popular basically, Shastho Batan. It is developed by Cine Society, the company, and Ministry of Health is basically the user basically. They deploy the system and huge basically call is coming every day. I don't know exactly how many calls per day, but the system is already established. So it is working, right? You can call now basically. And then e-learning platform from DSIS2 basically. This system is basically developed by me. I have developed this solution, basically e-learning platform for Ministry of Health Okay. So you know DSS2, the District Health Information Software basically. This is a platform for collection, validation, analysis and presentation of aggregated statistical data basically. This is a basically analytical tool basically. So all the indicators basically, different facilities like tertiary level, district level, Thana level, community level, all data basically collected by this DSS2 software. And it is stored in the central database basically. And Ministry of Health has a data center, you know that. So all data is coming and they analyze the data and they basically show in the dashboard. So people can get a picture of whole Bangladesh. What is current situations? How many basically mortality, morbidity, everything we get. Public health surveillance system. So Digi Health. This is basically MIS, Ministry of Health. MIS basically is the implementer basically of all the system basically. So this system is already, because you can go this link, you will get the system. The link is, I have already written the link, website link. So you can just click and you will see the system, this is available. So public health surveillance system, basically this is your field. Since you are an MPS program, so you already know what is the surveillance system basically. Do you know biosurveillance? What is the purpose? The surveillance system. Basically tracking the disease basically. Where basically exactly how many people are suffering, and so each day to day you are collecting their information and you are monitoring basically. This is important basically. So this is one of the basically major part of public health domain basically. So public health surveillance is the continuous systematic collection, analysis and interpretation of health related data needed for the planning, implementation and evaluation of public health practice. So there are three basically surveillance activities basically. Serve as an early warning system for impending public health emergencies, document the impact of an intervention, or track progress toward specific goals. So maybe you have a goal, right? Okay, we'll reduce 50% of particular disease. So this can be your goal and you will intervene that things. Monitor and clarify the epidemiology of health problems to allow priorities to be set and to inform public health policy and strategy. So basically, after tracking the disease, you can also, it will help also to make the policy basically. So what should you do basically? The preventive measure you can take based on the current scenario. So that's why you need a tracking system basically, disease by disease basically. So for example, dengue can be a best fit right now. So government can basically establish a central tracking system. People, whoever basically affected the dengue, he will report. Do you know that DSS2, this software, already have the dengue information? How many people, where the location is, so how many people is affected, how many people died, how many people already cured, that is information is available in the DSS2. Because Ministry of Health already instructed different hospital clinic that whenever one dengue patient comes, you have to report. And that report is already available in the DSS2. So government can make a policy next year. Okay, this year we have, for example, Mirpur has a high prevalence. So they will focus on here. For example, I don't know where is the most prevalence area. So, and you see one picture in the Pothomalo paper I saw that there is a mapping. So where is the most densely dengue patients are resided. So they show and you can avoid that area. Okay, I will not visit that area. So people can basically use different way. So you can develop an app basically. Someone install the app. Whenever he visit the dangerous area, it will alarm you. Okay? For example, you are just walking beside a highly risky area. dengue area, the apps will give you alert and it give you a message. Okay, be careful, there is some dengue. That type of apps you can develop basically. It's called augmented reality. You can add that features. It's called augmented reality. If you can develop, you will be famous in Bangladesh. So I'm giving you one idea today. Think about it. So there are two types of public health surveillance, basically passive surveillance and active surveillance. What passive surveillance means? Diseases are reported by healthcare providers, simple and inexpensive. This is easy basically. The active surveillance is health agencies contact health providers seeking reports, ensures more complete reporting of conditions basically. So there are two types. 9 key challenges of e-health. So now we'll talk about what is the challenges of e-health. So it sounds interesting, but it has some challenges like lack of adequate awareness of the value of medical informatics, and e-health is the development of health services. Surveillance আপনি কিছু সিস্টেম ইউজ করতে পারেন, ডেভেলপ করতে পারেন। পিপল কি করবে? অ্যাপসের মাধ্যমে হতে পারে। অ্যাপে কি বলবে? সে রিপোর্ট করবে। এই মুহূর্তে খুব বেশি একটা বাংলাদেশে বায়ো সার্ভেলেন্সের উপর বা ডিজিজ সার্ভেলেন্সের উপর খুব বেশি কিছু নাই আসলে বেসিক্যালি। যেটুকু আছে সেটা হচ্ছে DSS2 এর মাধ্যমে ওই একটা সলিউশনই আছে, ওইটার মাধ্যমেই সব কিছুর মানে সব নিড ওই একটা দিয়েই ফুলফিল করার চেষ্টা করা হচ্ছে এখন পর্যন্ত। বাট এটা করতে হলে তো ইনিশিয়েটিভ লাগবে, আমাদের যে হেলথ ইনফরমেটিক্সের নলেজেবল পিপল লাগবে মিনিস্ট্রি অফ হেলথে। সো আমাদের অলরেডি কিছু স্টুডেন্ট আসছে মিনিস্ট্রি অফ হেলথ থেকে, তারা হয়তো বা ইনিশিয়েটিভ নেবে এবং করবে, ঠিক আছে? বাট ইট টেক্স টাইম বেসিক্যালি, তাই না? এটা এত সো কি চ্যালেঞ্জ? ফার্স্ট ওয়ান তো অলরেডি বললাম, ই হেলথ in the development of health services, the absence of a clear vision among the health institution designated to provide healthcare service. So clear vision নাই একটা হচ্ছে, lack of interest in developing the basic strategic plan appropriate to the situation of the medical institution. Some strategic plan are not applicable because they are not appropriate and do not take into account the needs of collaboration of available resources. Inability to bear the cost, তারা cost bear করতে চায় না। Lack of experience and lack of good and qualified human capabilities. Always we have lack of quality human resources basically. Weak infrastructure including the rehabilitation of human cadres, medical and non-medical, to deal with the concept of e-health and the provision of service. So we don't have clear basically understanding of e-health. We don't have infrastructure, okay? And then absence or weakness of laws and legislation. So we don't have that much legal framework to justify the activities. For example, we don't have any policy for e-health basically. We have a draft policy, but we don't have any full policy. So how can you develop a system? If you develop a good system and you institute in government will say, who give you the license? Did you talk with me? So there are some legal issues also. So in health sector, if you develop a electromedical equipment, can you just deploy it without the test or the validation, authorization? You cannot do that. So there are some legal framework should be there. কোনটা? এটা লেকচার স্লাইড দিয়ে দেবেন, আনসার আপনাদের দিয়ে দেবে, সমস্যা নাই। So poor level of cooperation and linkage between different health sectors. This is the 9 e-health. And the conclusion is the use of ICT within the field of healthcare is becoming an increasingly important aspect of a clinician's professional practice, improving the delivery of health services and communication between healthcare workers, as well as enhancing the decision-making process through the efficient flow of information. Basically, the last line is the important. So decision-making process basically. The health informatics basically help physician to make easy decision, efficient flow of information. So the flow of information you are capturing and you are using that one. So open discussion on health informatics application. Basically we are data for decision. So whatever you're doing from the technology, we are storing the data basically, patient record, health record, and you are basically making decision, faster decision. For example, you cannot memorize the 6 months before you treat a patient. Can you remember? It's not possible. 100 patients per day, one OPD doctor is treating every day. So, but system basically help us to store everything, and even single click, the patient data will come in front of you within single second. But you cannot recall from your memory. So that's why basically health informatics application or e-health or digital health basically help you, basically doctors, basically. We are basically helping doctors to make right decision at the right time. So the decision making and the flow of information means we are basically dealing with the information, basically, patient information, mainly. So whatever you are talking. So open discussion of health information, any thought?
Patient information, how to sir, decision making, sir, analysis.
সবই তো আপনি কি অ্যানালাইসিস করতেছেন, আপনি তো বেসিক্যালি ডেটা অ্যানালাইসিস করতেছেন, আপনি একটা ল্যাবরেটরি ডেটা পাইতেছেন, ওইটা নিয়েই তো আপনি বেসিক্যালি একটা রিপোর্ট বানাচ্ছেন। সো হোয়াট এভার ইউ আর টকিং এভরিথিং ইজ ডেটা। মানে দিন শেষে আপনার কাছে ডেটাই থাকতেছে। আমি আপনার সাথে অনেক কথা বলতেছি, এই যে লেকচার দিতেছি, পাওয়ার পয়েন্ট প্রেজেন্টেশন দিতেছি, এগুলো কি সব ডেটা, সিঙ্গেল ফর্ম বেসিক্যালি। সো এটাই আপনি বিভিন্নভাবে ইউজ করেন। কেউ লেকচার দিচ্ছে, কেউ একটা প্রেসক্রিপশন লিখতেছে, কিন্তু প্রেসক্রিপশনটা কি? ইটস এ ডাটা।